typically when it's time to push, we always say, okay, it's time to push. And sometimes that can create like extreme panic in patients. And other times they're like, oh my gosh, yay. So if that's like a moment that is way too overwhelming for the patient, we'll say, you know what, looks like you need a moment. I'm going to explain this a little bit. We're going to leave for 5 minutes. You're going to regroup, and then we're going to come in and do that. You do need to be in a good headspace to be able to do that. So if it's like so panicking to you as a patient, I always say, like, if the baby's doing okay, you could say, okay, can I have a minute to wrap my head around this? Because maybe it happened so fast or whatever.
Yeah.
But sometimes we might say, the baby's really not looking good. We got to push. And sorry, this is just what you have to do. And then
Yeah.
we do get a little aggressive. And I think um, no patient has ever said, oh, you were so mean to me. If I'm like yelling at them, it's always like warranted if we're like really just going after it. So sometimes we'll have a huge decel. We run in, we check them, they're complete. The baby's still down, and we're thinking, oh, we might need to go to a C-section. Then we
Mhm.
check her, say, oh, she's complete, and we'll just go right at it and don't care what position you're in or anything. Everyone's just like push, push, push. We're trying to get the baby out.
Yeah.
Otherwise, if it's a controlled environment, you're complete.
Mhm.
I tell every patient, okay, I'm going to tell you how we push, how I've seen pushing work. If you don't want to do it this way, that's great. If you have another idea, that's great. And then you can do your own thing. If they do their own thing and it's 30 minutes in and I'm like, this was the worst way to push, I'll give that advice then. But I don't want to shut them down from what they're feeling like their body is telling them to do right off the bat.
Mhm.
I tell them, okay, standardly, we're going to push on your back. This is for like an epiduralized patient. We're going to pull both your legs up. I always say knee to ears, which is very aggressive, but just to kind of get the idea that we're really opening up your legs and pulling them back. I like my patients to reach their hands, both hands kind of underneath their legs and kind of pull up. And then I have the partner, if they want to stay up at the head, that's totally fine.
Mhm.
But I have them kind of support the foot. And it's really important to know that they're not leaning in and like pushing, because we get so excited that we kind of push with the patient, and you don't want to pull the patient's hip back because you could hurt their hip. So it's
Mhm.
really them doing the pulling. And then I say, we're going to do 3 pushes per contraction. So we do about 10 seconds, push, and then let your breath out. Take a big breath in, go right back at it. We're going to do that 3 times. Um, this is how, it's a very standard way. If this doesn't work for you, that's great. We'll try other things. We can try being on one side and with the leg up. We can also, with an epidural, we can do hands and knees pushing. So having them up and kind of sitting into it. We have squat bars we can try to put the legs up on. People do tug of war. I'm the worst tug of war nurse in the world. I do not do it that often. But if that's something you want to do, you can ask your nurse to see if they have a bar. They should, and then
Mhm.
they just kind of pull. It's hard, but it's hard to get. For me, I don't like it because my patients are always putting it in their upper body, and so they're working so hard with their upper body. But there are countless times it has helped the patient. But we just kind of do that, and a lot of times pushing can depend on the baby. So some
Yeah.
babies are doing really well with pushing. Other babies, we have to have them tilted all the way on the side for the pushing, or maybe they are just tolerating flat on their back. Sometimes that is a really good position for the baby. Um, so it's hard because there's so many variables. If you're going unmedicated, you could be standing, you can be squatting, over the bed. You can really push however you want. I don't think there's a
Mhm.
bad way to push except for like having your legs shut. And there are different variations of pushing that we'll try, especially with the epiduralized patient. There is one where you do knock kneed for a little bit.
Yeah.
And when I was taught that one, that was like really interesting because they had us kind of hold the back of our hips and see when you move your legs from knock knee to knot, you can really feel like the back of your hips and your pelvis open.
Mhm.
That one can be really confusing for the patient, but I'll do
Yeah.
like 2 contractions and I push their knees together so that and that one's really, they're like, what are you doing? Why are my legs closed? But that one's not
Yeah.
to be done long term. There's different stations and different
Mhm.
times to do pushing, but otherwise it's just give it your all. I coach closed glottis is I think what they call it.
Yeah.
So like bearing down and holding your breath with those contractions. I do think there's so much more power in that. When the mom is letting their breath out, you're just losing so much strength that you have. So if
Interesting.
the patient really wants to do open glottis pushing, I will allow it. But if it's not making progress, then I'll say, you know what, why don't we try to hold your breath and really just bear down like you're constipated, like you're trying to poop, all that kind of stuff, because that's the way to get the baby out.
Yeah. I love that. Is there like a position that you see where you're like, wow, I've seen so many women do this position pushing and like they're not tearing a lot. Because
Oh
some
yeah, I
people will
forgot that
say,
question.
yeah, like some
Well,
people will say, oh, side lying. Like there's
I was
some
gonna
research
say,
now
I
that side
had
lying is beneficial, but
yeah, I had this nun midwife once, and we were pushing, and she kept being like, "You have to go on their left side. They have to be on their left side." And I was like, "What is she talking about?" And then she was like, "That's the only way they don't tear." I guess that must be somewhere that side lying reduces tearing. I haven't done a lot of research myself on that. So I don't know, but I have been told that. So I do keep that in mind. For me, when I'm thinking about tearing, it's that final stage. So when whether we're on your back or side or whatever, I have had people push on their back and not tear. Um, it is so much easier to not tear when it's your second, third, fourth baby. So
mhm,
when primates are like, "Oh my god, I tore," sometimes they only have a very small tear. I'm like, "That's really, really good."
yeah,
And so when you're crowning, the pressure is so intense that some women just freak out and push through and get the baby out, and that is what causes a big tear. Is a
mhm,
the final push where you just kind of lose control and push just to get it done. So I will warn my patients before and say, "Okay, we're getting close. So when this pressure is so intense, I'm going to lean down and say, small pushes, and please try to do that because what we're doing is allowing the baby time to stretch. Hopefully, the baby tolerates it. Some babies, their tones are down and their heart tones are down, and so then we just say, "Oh, sorry, you're gonna tear, and we got to get the baby out," and that will just happen. But if we can allow it, then we will let the baby crown slowly, and then it's a lot of some people even do feel the burn with the epidural. So
mhm,
burning, pressure, all that. But I say, take a little breath, take a breath, and then just have them kind of like very slowly breathe out and just a slow ease. And that allows all that tissue to tear or to not tear, hopefully, prevent the tear. But you can also have the midwife or the provider do warm compress, and that can help too. Um, so putting a warm compress on the perineum when you're pushing can hopefully prevent some tearing. But really,
mhm.
it's just about easing out that head very slowly.
Yeah.
That is going to prevent the tearing.